Good morning. I now convene this morning's hearing entitled "Where Have All the Patients Gone?" Examining the Psychiatric Bed Shortage. I now recognize Judge Leifman for 5 minutes.
Thank you very much, Mr. Chairman, members of the subcommittee. My name is Steve Leifman. I am a judge from Miami-Dade County, and I chair the Florida Supreme Court Task Force on Substance Abuse, Mental Illness, and Issues in the Court. You ask, where have the patients gone? Sadly, the answer is jail and prisons, and this is an American travesty. As you already stated, in 1955, there were some 550,000 people in state psychiatric hospitals around this country. If nothing had changed, and we use today's population, there would have been about 1.5 million people in state psychiatric hospitals today. Last year, 1.5 million people with serious mental illnesses were arrested in this country. On any given day in the United States, we have approximately 500,000 people with serious mental illnesses in jails and prisons, and another 850,000 in the community on some type of community control or probation. Since 1955, we have closed 90% of the hospital beds in this country, and we have seen a corresponding increase of 400% of the number of people going to jail with mental illnesses. And because jails are not conducive to treatment and courts do not know what to do with this population, people with mental illnesses generally stay 4 to 8 times longer in jail than anyone else with the exact same charge who does not have a mental illness, and costs 7 times more. I had no idea that when I became a judge, I was actually becoming the gatekeeper to the largest psychiatric facility in the state of Florida, and tragically, that's the Miami-Dade County Jail. I see more people on any given day with mental illness than most psychiatrists see in a month. People with mental illnesses in this country are 3 times more likely to be arrested than to be hospitalized, and in my state, it is 9 times more likely. The closing of the hospitals is not the only and primary reason all these individuals had ended up in hospitals. It is a combination that created the perfect storm. It includes the IMD exclusion. It includes what Medicaid pays for its services. It includes the war on drugs. It includes the reduction of hospital beds. It includes the antiquated involuntary hospital laws. They have all conspired to create this perfect storm. And if this wasn't bad enough, just listen to the cost this is having to our communities. We worked with the Florida Mental Health Institute at the University of South Florida in Tampa. We wanted to know who the highest utilizers of criminal justice and mental health services were in my county so that we could wrap our arms around this population to see if we could get them services so they didn't keep reoffending. I thought I would get a list of thousands of individuals back. They sent me a list of 97 people, and I guarantee every one of you have these same 97 in your communities. These 97 individuals, primarily men, primarily diagnosed with schizophrenia, over 5 years were arrested 2,200 times. They spent 27,000 days in the Dade County Jail, 13,000 days at a psychiatric hospital or an emergency room, and cost taxpayers $13 million, and we got absolutely nothing for it. We would have been better off sending them to Harvard and maybe giving them an opportunity for an education. It is an outrage. The other part of the problem is that where we spend our money is killing us. In Florida, we spend 1/3 of all of our adult public mental health dollars, that's almost $250 million, to try to restore competency for 2,700 people. We have between 170 and 180,000 people in any given year in Florida who at the time of their arrest need acute mental health care treatment. But we spend 1/3 of our money trying to restore competency so we can try these 2,700 people. Well, 70% of these individuals have 3 things happen to them. Either the charges are dropped because the witnesses disappear, they get credit time served because they've been in the system so long, and they walk out of the front door of the courthouse without any access to treatment, or they get probation and they walk out of the courthouse without any access to treatment, and we just spent $250 million, and that money is coming out of the community mental health system, making it harder for people to get access. It actually meets the definition of insanity. We keep doing the same thing again and again, and we expect a different outcome. It's even worse at the prison level. And on the competency restoration, in the United States, we're spending almost $3.5 billion, and we're getting very little return for that money. The fastest growing population in Florida's prisons are people with mental illnesses. While our prison population has begun to stabilize over the last 2 years, the mental health population continues to grow at exceedingly alarming rates. Over the last 15 years, the serious percentage of people with mental illness has grown by 178%. We went from about 6,500 people with serious mental illnesses 15 years ago to 18,000 today. is going so fast that it's projected to double again in the next 10 years. Florida needs to start building 10 new prisons for the next 10 years just to get to this population. It will cost my state $3.5 billion to deal with this population if we don't do something soon to correct the problem. We are looking at huge cost and we're getting very little for our outcome. We have a three-legged stool that is wobbling and about to break, and there are three parts that I really hope that you are able to address. The first part is how and what we finance through federal Medicaid dollars for mental health services. It doesn't work. The second somebody is no longer a danger to self or others, Medicaid will cut them off and the hospital will discharge them back to the community, often to homelessness, often into the criminal justice system. The second part that needs to be addressed is the antiquated involuntary hospitalization laws. Most of these laws were written before we had TV, microwave ovens, computers, brain imaging, and antipsychotic medication. It is an absurdity. The first laws come from 1788 out of New York. It doesn't work. People cannot get into the system to get treatment, and then when they're ready to be discharged, there's nothing for them. We have made, and the third part is that we need to have a coordinated system in the criminal justice system to make sure we can take care of this population. And just let me make two quick points. We are doing some significant things in Miami-Dade County that are having huge impacts. We have trained over 4,000 police officers in order to identify people with mental illnesses in the community. Last year, the city of Miami and Miami-Dade County did 10,000 mental health calls. These 4,000 officers only made 27 arrests out of these 10,000 calls. Our jail audit plummeted from 7,800 to 5,000, allowing the county to close a jail and saving $12 million. We also have post-arrest diversion programs where if someone comes in, we get them treated and make sure that they're not just discharged to the community without any assistance. We're saving lives, we're saving dollars, and we're starting to make the system work, but we need to fix those other three pieces. We also need to begin to use advanced technology, which we are beginning to do. We are part of a unique private and public partnership in Dade County where we're working to see if predictive analytics can actually be used in the behavioral health space so that we can have an unfragmented system of care, more accountability, and make sure that people with mental illnesses are treated fairly and properly. Thank you very much.
Thank you, Judge. I was afraid to gavel a judge.